Hello everyone, this is Access to Services. This is one of our legal webinars. Today we have Damian Bradley of Express Solicitors and also alongside Sue Tomkinson, who is a palliative care expert and associate of Maggie Sargent and Associates. Damian, welcome.
Thank you, Victoria. Welcome and thanks for joining us. I'm extremely privileged to be invited by Burning Knights CRPS support to host this webinar. And before we move to the main speaker, I just wanted to take a few moments to provide a brief overview of the presentation and to explain what role I play as a personal injury solicitor in facilitating access to services. I want to talk about the relationship between a care expert, such as Sue Tomkinson, our speaker, and Express Solicitors, and the partnership with the Burning Knights charity. Express Solicitors are part of a select Burning Knights legal panel. The main condition of being accepted as a panel member is that you must be a lawyer who has specialist experience in pain cases, such as CRPS. I am the ambassador for Express Solicitors and have been representing clients with CRPS and other pain syndromes for well over 10 years now. So if a Burning Knights member was injured as a result of another person's negligence, or you could say through no fault of their own, and they unfortunately went on to develop CRPS, for example, then that member could contact Express Solicitors for a free consultation to see if they have sufficient prospects to bring a claim. Just to give you an example of one of my current cases, the chap was at work doing some maintenance and he slipped on some grease that had been left by another worker. He was holding a screwdriver as he fell and he landed heavily on his wrist. He badly fractured his wrist and he damaged his tendons and nerves. Unfortunately, he's now gone on to develop CRPS in that hand. So he's claiming not just for the initial injury, but also for the CRPS that's followed. A medical expert's prepared a report and this supports the onset of CRPS, that was caused by the trauma to his wrist. Now we represent clients in all forms of accidents. So the free consultation is open not just to members, but to their families and friends too. Now, if we're acting for a personal injury client, and when we're trying to arrange access to services, we're looking at a few options. Firstly, we can ask the insurer on the other side to agree what's called an immediate needs assessment under the Rehabilitation Code. If they agree, then a rehabilitation provider will be instructed to prepare a mini report after a meeting with the client. This report, which is known as an INA, will make various recommendations. This could be physiotherapy, CBT, and more of that later in Sue's talk. The advantage of this is that the insurer pays for the INA, and this rehabilitation can go on irrespective of the claims process, and theoretically, even if liability is denied in the claim. Now, the insurer may also agree to pay for the recommendations that are made in the INA, so that's an obvious advantage. If the insurer does not agree to provide rehabilitation under the code, then Express Solicitors can instruct a rehabilitation provider direct to provide an INA, and this will be without the insurer's involvement. We would then separately ask the insurer for a sizable interim payment, which can be used to fund the recommended rehabilitation. In the more serious cases, the recommendations may involve some case management. Now, what's case management? It's described as a collaborative process which assesses, plans, implements, coordinates, monitors and evaluates the options and services required to meet an individual's health, social care, educational and employment needs using communication and available resources to promote quality, cost-effective outcomes. The interim payment can then be used to appoint a case manager who ideally is personally chosen by the client as they need to have a good rapport, and then to pay for the case management services and for the recommended rehabilitation. Another way that the lawyer can get involved in access to services is by instructing a care expert, such as our speaker, Sue Tomkinson, to prepare a detailed report on the needs of the individual. This report will be used as expert evidence for the claim itself. Costings will be prepared in the form of detailed calculations, and these will be across various areas, such as care paid for on a private basis, aids and equipment, and specialist transport needs, For example, a vehicle adapted for a wheelchair user. And Sue will talk about these in more detail shortly. Now, the care report is used by the lawyer to calculate large parts of the schedule of loss in the claim. So it's very important that the most experienced and respected care experts are used, as it can make a serious difference, sometimes many thousands of pounds in a large claim. Now, what I've just covered very briefly is generally how we would approach access to services from a legal claims point of view. However, this webinar is aimed at all members, not just those who have claims or are able to pay for services out of their own pocket. So Sue will look at a range of different types of services available, from psychological support, pain management programs, wheelchair services, through to physical assistance, and highlighting lots of different equipment that's available that you just might not be aware of. Sue will be pointing out where Burning Knights can lend their support along the way, with Victoria on hand to go into a bit more detail where necessary. Finally, we'll be taking questions at the end of the webinar, so please come forward with your queries for the panel. Without further ado, it gives me great pleasure to introduce our main speaker today. Sue Tomkinson is a care expert with Maggie Sargent and Associates, who has for many years experience in preparing reports in personal injury cases as an expert witness. Sue continues to be regularly instructed by Express Solicitors on our clients' claims as a well-regarded care expert. Sue has a background in nursing and is particularly well suited to speak today, as you will hear, as Sue begins to tell you a bit more about herself in her presentation. Thank you for listening, and over to Sue.
Thanks, Damian. So this presentation today is all about access to services for people with a diagnosis of CRPS. Next slide, please. Okay. A little bit of a background from myself. I qualified as a registered nurse a long time ago before undertaking a degree in palliative care, which also covers pain and symptom management. Both of these areas are relevant when providing advice and support to those with a diagnosis of CRPS. Having worked as a nurse for many years, around 14 years ago, I was approached and asked if I would consider working as a nursing and care expert, working with clients who had been involved in medical negligence and general accidents. Although I had already done my palliative care degree, it was only when I began carrying out this new role as a nursing and care expert that I fully understood the prevalence of CRPS within the general population and the lack of awareness of this condition. Next slide, please. Within my role, I work for instructing solicitors to assess a client and to consider the past and future care needs, as well as basic equipment relevant to their condition. We are fortunate within this scenario to be able to recommend therapies and equipment on a private basis. The NHS provision for pain management and treatment on an inpatient or outpatient basis involves a very long wait time. This is, in my professional opinion, further complicated by people with CRPS and associated conditions quite rightly visiting their GP in the first instance, but GPs are simply that. Next slide, please. GPs are general practitioners with the ability to diagnose numerous conditions and to refer patients on for a specialist provision. However, complex regional pain syndrome is a very specialised area, with the number of pain specialists in this area very limited. Although I do have to say, with the 14 years experience of doing this role, I'm very happy to say that this is improving over time. It's still not at an optimum level, but there are more pain management experts out there than there was when I started this new job. Therefore, to access this service via the NHS can take several months, if not longer, and this is not uncommon. Knowing how to access specialist services relating to this condition will make the process more streamlined and remove some of the stress you feel at what is already a difficult time for you. So, what is CRPS? Complex regional pain syndrome, abbreviated to CRPS, was previously known as reflex sympathetic dystrophy. It's a very poorly understood syndrome whereby the level of pain far exceeds the initial level of injury. It can be caused by, for example, a heart attack, a stroke, or injury, and leads to constant and debilitating pain. Anyone who is accessing this webinar will either have a diagnosis of CRPS or know someone with it and will be familiar with the unremitting pain it causes and the effects that this has on someone's life and the lives of those close to them. So, why is a formal diagnosis of complex regional pain syndrome so important? As a nurse, many years ago, I was always told that a diagnosis is simply a diagnosis. But in my expert opinion and my professional opinion, when you have constant pain, which has been caused for whatever reason, which does not go away, you need to know why. Because no matter what you say, no matter how you feel, nobody will understand your pain. And you need to have some sort of diagnosis to put your mind at rest. Many people who are suffering from pain, which is excessive to what is expected, in my opinion, feel as though they are imagining their symptoms. And it is their understanding that they should be getting better and not worse. This doesn't happen with CRPS. Many people begin to doubt themselves, and the internet, which is obviously a big part in everybody's life nowadays, is usually a platform which people use to investigate their symptoms in the absence of professional opinion and guidance. Rather than helping the situation, accessing the internet will often increase someone's concerns, and it can, again, in my opinion, be very harmful. And from my experience, can be very harmful. A formal diagnosis provides you with clarity and the reassurance that you're not imagining all the symptoms that you are experiencing. And it is very important to remember that whilst many people may have a similar background of injury, which is brought on the diagnosis of CRPS, that everyone's experience of pain is unique to them. Confirming a diagnosis of CRPS can take many months. As the condition is still not widely recognised, as it should be, in legal cases, providing this and the difficulties that flow from it can be demanding, and it is imperative that you have experts in the field to represent you. If you have a legal claim through Express Solicitors, they will instruct an expert in pain management to assess you, as well as a care expert with the relevant experience in the area to ensure you are represented as robustly as possible. Therapeutic support. Many of my clients have needed practical assistance and guidance to access services available to them. It's not widely known to everybody. This can be done via your GP, and at this point will be free of charge, provided by the NHS. However, and this will be a common theme, the waiting times for any NHS provision can be extensive, and this has been further compounded by a backlog of patient referrals following the COVID-19 pandemic. In addition, pain diagnosis and therapy is a very specialist provision, and whilst this has improved over the last few years with more pain consultants available, the waiting time for appointments is usually in excess of those for more general conditions. Burning Night CRPS support provides free information and guidance, as well as their own support services for people living with CRPS. This includes a dedicated CRPS counselling service. One service overlooked by many is peer support. It's undervalued and under-recognised. This can be accessed via online forums or when attending therapy, such as the pain management programme. Often people with CRPS and associated pain syndromes can feel very isolated. No one understands what they're going through. They have nobody to talk to, and those that they do talk to really can't understand what's going on. This, again, is compounded by the fact that the levels of pain are far in excess of the injury sustained, and as such do not make any logical sense. Things are not getting better, they're getting worse. For this reason, many feel that others do not believe them, and clients, patients start to doubt themselves. Often people feel that their injury and subsequent difficulties will resolve, and when it does not, it can become confusing, frustrating and debilitating for them. Many of my clients feel so relieved and appreciate being able to simply talk to someone about their symptoms. And I have this when I do assessments on a regular basis, when clients will turn around and say to me, it's so nice just to speak to somebody who understands. Victoria, do you want to talk about this, or do you want me to carry on?
Entirely up to you, Sue. I don't mind doing it if you would like me to.
No, I'll do it then, that's fine. Burning Nights holds monthly support groups for CRPS patients and loved ones, enabling those affected by CRPS to engage with people with similar experiences and come together to provide support and advice. Following the pandemic, these continue to be held online for now, allowing them to be accessible to people who might have otherwise struggled to attend in-person support groups. The dates for upcoming support groups are available on the events page of the Burning Nights website, and I would urge everyone to look at this. Another way to engage with the CRPS community for peer-to-peer support and ask questions about the different challenges that come with a diagnosis is a 24/7 community forum on the Burning Nights website. This platform provides an outlet for both sufferers and carers to share experience of their condition or just to have a general chat. This is really important because it's not just the person who has the diagnosis, it's the carers, it's those living around them. Everybody needs to have a clearer understanding of what the person is going through. It does affect everybody. The recent edition of the Burning Nights befriending service has proven to be very popular, unsurprisingly, with the service being in high demand since it was introduced. Our volunteer befrienders, who themselves live with CRPS, provide a weekly phone or Zoom call to a fellow patient for a course of 12 weeks. CRPS is an extremely isolating condition, and with the impact of repeated lockdowns, people have been feeling that more than ever. These regular friendly chats are an opportunity to engage with another member of the CRPS community and to help those who need it to feel less alone. Self-referrals can be accepted through the Burning Nights website. This feeds into exactly what I've just said, where people they're isolated, they need peer support, and talking to somebody who's got the same condition as you will be invaluable. So, pain management clinic. Pain management clinics can be accessed via your GP. However, again, unfortunately, general practitioners are general practitioners. They will refer you to a pain management clinic, but there is liable to be a very long wait time via the NHS. You should also be able to attend for an assessment on a private basis via your GP, but this is something that you will have to ask for. In my opinion, in my experience, it's not readily provided to you without you actually asking. Pain management clinics and pain management programs can be accessed privately. They are very expensive unless you have the relevant medical insurance within which this is included, which very often isn't the case. Pain management programs. These are recommended by the treating pain management team following an assessment with them. Sometimes there is a choice of attending on a daily basis at the local hospital, and some specialist provisions provide a residential program, and they will recommend a number of weeks dependent on the level of your symptoms. And residential pain management programs are usually held Monday to Friday each week, and then you come home at the weekend, Saturday and Sunday, and then go back for the number of weeks prescribed. A lot of people find this quite difficult if they've got young children or they're responsible for other adults or carers. But in my experience, again, they are invaluable, particularly the residential pain management programs, because you're away from everything and you're just focusing on the CRPS. They can also be accessed privately, but the cost, again, it is very high. And in some cases, someone who has an ongoing medical legal claim, the cost will be included within the damages award, or at times can be accessed while the litigation process is ongoing. If this is recommended by a pain management expert, which you will always have access to if you have an ongoing claim, they will recommend a pain management program if they think it's necessary. So that will be included in the cost, and you can do it while the claim is going on. If the claim settles and the care expert has allowed for a pain management program on a residential basis, then the award at the end, when the claim has settled, will include the cost of the pain management program. These are quite limited across the country. There's not one in every county or every area. There are several, but they are dotted around the country, which is another consideration when accessing a pain management programme. Psychological support. It should be noted that this is of equal importance to the physical or pharmaceutical support, as in pain management, analgesia, medication. If you are able to attend a pain management programme, then psychological support will be included in that, which will be counselling. It could be one-to-one support. Again, talking to peers, invaluable. Your GP can refer you for this support, and as with all other services, you can also access this privately. I'm not going to go over it again, but access is very limited on the NHS. It is there, but it does take a long time. The support can come in varying ways. It can be face-to-face, although this has been difficult and is not as frequent as it was prior to the COVID-19 pandemic, obviously. Alternatives are telephone assessments such as Healthy Minds or talking therapies provided free of charge by the NHS, which again, they can be by telephone or by Zoom assessment, which is on a computer. Not everybody has access to Zoom. It's not easy for everyone. Anyone over the age of 16 can self-refer for this provision, although a lot of people do prefer to have face-to-face assessments, and hopefully they will be coming back in the future. Remote assessments are an alternative, which we have to live with at the moment. Mind is a national charity providing mental health support. They offer a free consultation appointment and then will advise you of the proposed treatment and associated costs. Obviously, they cover a wide variety of mental health conditions and don't just focus on CRPS as Burning Nights do, clearly. Your GP can also refer you for counselling, and this is always, as we've already discussed, part of the pain management programme. In my professional opinion, counselling is very personal. You will be discussing things which are pertinent to you and can bring emotions and fears to the surface, which is likely to be overwhelming. A lot of my clients will say that they don't need counselling because they will talk to their family. Often it's easier, and I do have first-hand experience of this, to talk about somebody away from the family unit. You are talking about things that are very personal to you, and it can be, it is overwhelming, it's all-consuming, and it can be upsetting. But the outcome of counselling is usually very positive. You will need to develop a trusting therapeutic relationship with your counsellor, and this will take time. So when you start going, it won't all happen in the first couple of weeks. It may be that the first couple of times you speak to someone, you are simply doing what we're doing today and just talking, getting to know them. You have to feel comfortable and confident to open up to somebody. Your GP may refer you for more intensive and specialist counselling, such as cognitive behavioural therapy, CBT, or EMDR, rather than generic counselling provided by some organisations as noted above. But that is up to your GP. Who will know if you need more specialist support, or again, the pain management team. The Burning Nights CRPS Counselling Services provides 20 therapy sessions with a trained therapist free of charge. It is available to anyone in the UK affected by CRPS over the age of 5. It even happens to people that young, whether they are a patient, a loved one, or a carer. And I think that is so important because, again, it provides an holistic provision to not just the person who's suffering with the CRPS, but the family. As with the support groups, therapy sessions are currently available online, enabling clients to access the service from the comfort of their own home. Self-referrals are accepted, and anyone who is interested can sign up on the Burning Nights website, and I would urge you all to do that if it's something you want to consider. Help around the home. Although we've talked about counselling and diagnosis of CRPS, it's often the physical assistance that makes a difference as well, along with the pharmaceutical and the pain management and, analgesia and everything else. Social services can provide some support following a care needs assessment if social services are involved. This can include assistance with physical needs and care, as well as aids and equipment for use around the home. However, it should be noted that social services only provide the absolute essential care support and basic aids and equipment needed. A financial assessment is carried out, which will assess whether or not you will be eligible for either of these free of charge. If you do have to fund this support yourself, then the assessor from social services will be able to provide you with information on suitable local care agencies with which they are familiar, as well as with providers of aids and equipment. If you're not eligible for free support, then local agencies can be found online via the internet. Often the agencies also provide care nationally, so be sure to ask if they cover your specific area. Some of the agencies, if you have to put in your postcode and it will tell you straight away whether or not they will cover where you live. Privately funded care and support is not cheap, and as the agency also have their add-on costs within the hourly rate, this will include things such as staff holiday pay, insurance, training, sickness to cover. That's just to name a few. The rate that you will be charged by yourselves is not the hourly rate which will be paid to the support worker or carer. As again, the same applies as it does with counselling. To find the right support worker or carer is very difficult, and it needs to be the right person. It might be that you have somebody, you need to be interviewing people. You know, they need to come to your house, you need to see them. Don't just accept what anybody recommends. You need to meet these people, you need to have a good relationship with them. And if something happens that you start to employ them and this doesn't work out, then you are well within your rights, whether you pay for this support or not, to ask for somebody else. An initial meeting with the agency to discuss your needs and what they provide will be undertaken, and this just feeds into what we've already discussed. And while they match with someone with you based on your needs, it's worth remembering that you have the choice to ask for an alternative carer should you wish. They are coming into your home, and as such, the thoughts of you and your family are important in the whole process. This support can be for personal care or things such as meal preparation or cleaning. Personal care covers an array of things. It can be help with washing, bathing, dressing, or it could be just helping you to access the community, help with toileting needs. It can just be befriending, which is something Burning Nights do free of charge, but it could just be somebody coming in just to spend half an hour with you. As we said earlier, this condition can be very isolating at times. Following the COVID-19 pandemic, many staff are leaving the care agencies, and the costs of care and support, as well as domiciliary care, such as cleaning ages, have increased substantially, and this is something to bear in mind when accessing this support. Benefits. It's worth noting that attendance allowance is a benefit which is not means tested. In my opinion, this is a benefit which is underused. Most people do not realise it's applicable to them, and certainly that it's not means tested. It's for those who have a disability or illness for which they need help with care. And many people out there might be providing this help, but don't realise how much you do on a daily basis. And if you sit down and think about it, or write down or type it on your laptop, your computer, what you actually do on a 24-hour period to help somebody, you may well be surprised how much that is. If you are eligible for this, it can help you to receive other benefits such as council tax reduction, pension credit, or housing benefit. Your GP surgery may have, dependent on your age, an Age UK advisor who can help you with completing the application, or you can contact Age UK directly yourself, or a family member can help you to do this online. There are two rates dependent on your levels of need, but this can be an income you were not aware of that you could be eligible for, which can help with the provision of private care and support or aids and equipment to help you. Wheelchair services are a local provision which can be accessed by anyone. You can either be referred for a wheelchair by your GP, hospital staff, physiotherapist, or social worker if you have one. This is a free service and includes annual wheelchair services, so they maintain the wheelchair for you on a yearly basis. Alternatively, you can purchase a wheelchair as well as any other mobility aids and an array of equipment for use around the home. There are many shops you can access online, and most areas will have shops you can visit locally. If you just type in disability aids and equipment local to me, it will come up on the search engine, and there will be an immense amount of shops out there. All disability related equipment is VAT free. As outlined previously, if any aids and equipment are provided by social services, they will be those which are absolutely necessary, such as a bath board, a key safe, ramps and a step. Some of these obviously also have cost implications, such as the key safe. If you have the ability to purchase equipment yourself privately, then there are many local shops and also online providers who have a wide range of products available for home delivery. Which aids and equipment you require will depend on which area of your body your CRPS affects. If it's your upper body, your lower body, it could be both. Suggested aids and equipment for individuals with mobility difficulties will include both upper and lower limb difficulties. Wheelchairs are the most obvious. They can be manual or powered. They can be all-terrain wheelchairs and beach wheelchairs, which can be hired from local councils. There are so many options out there. It's quite unbelievable. They vary in size. They vary in cost quite a lot, unfortunately. If you have a wheelchair provided by the local wheelchair services, this will usually be a manual wheelchair, which you will probably have to have propelled by somebody else on your behalf. There may be the possibility of a powered chair, but this will be subject to an assessment from the wheelchair services. Walking frames are light, height adjustable and easy to manoeuvre. Not suitable for everybody, dependent on your mobility needs. An alternative is a wheeled shopping trolley, which is 4 wheels and you push it with both hands. The benefit of this is it's also got a seat on it, so you can sit down if you're walking for any length of time and you need a rest. You can also get a 6-wheeled swivel shopping trolley, again with a seat. It sounds like a very simple piece of equipment, but for somebody who's got mobility difficulties and wants to get out and about and is stuck in the house, just having a wheeled trolley that they can sit down, they can pop the shopping into the little basket underneath and they can sit down as needed, just gives you so much more independence than you had before. Stair lifts are available. They are either straight in nature or they can be curved. Many people nowadays have curved stairs going one way or the other. They will be dependent on an assessment, and it will depend also on the width of your stairs. Not all stairs are suitable for stair lifts if they are quite narrow. Stair lifts can be purchased or they can be rented from quite a few providers, and they are normally paid for on a monthly basis, and they are also maintained by the same provider. Crutches available in different styles. For example, they can be under the arm, they can be elbow crutches, forearm support, gutter or trough crutches, dependent on your needs and where your diagnosis of CRPS and pain affects you. Rollators available, and they come in various styles. Some again have seats to enable the user to rest. Some have storage bags, as we've just discussed, height adjustable handles and easy to control. And the height adjustable, the height will be dependent on obviously the height of the user. Fiberglass folding threshold ramp. This enables easy access over thresholds and similar obstacles. A lot of people don't want the standard concrete ramps, which are permanent, putting into the homes, which you can understand if there's no alternative. And it's personal choice as well, and depends on what provision you are entitled to, I suppose. You can have the folding threshold ramp, which can be put down when you need to access the property, and then it can be removed again. These are quite important sometimes to clients who have younger families and they don't really want disability related equipment scattered around the house. And again, that's something, you know, you can understand. However, equipment is becoming more user-friendly, in my opinion, over the past few years. And a lot of the equipment doesn't look like it belongs to somebody who's got a disability. You can have a metal half step, which reduces the distance needed to step up and down. So if you've got a step at the back door or the front door and it's more than a couple of inches high, metal half step just bridges the gap between the ground and the actual step into and out of the house. A portable doorway threshold ramp. Again, this is just another ramp that's used within a variety of different thresholds. Kitchen equipment around the kitchen, there's so much, but you can get things such as a nork, which is a combination knife and fork. Very strange name, I feel. Combination knife and fork, which enables the user to eat with one hand, as food can be cut up, but is not too sharp to cause injury to the mouth. So instead of having a knife and fork, you use the nork. Easy grip cutlery, which is adaptive living cutlery aid that can help people with dexterity issues or a weak grip and reduced hand movement. They've got larger handles which are designed in rubber and they give you a much better grip. A one-touch can opener, jar and bottle opener, can pull, tin opener. Again, such a very simple piece of equipment, but that will help somebody to increase their independence in the kitchen if you have difficulty with grip or loss of function to one hand. A kitchen workstation will enable someone to assist safely in preparation of food, meals, and encourages independence. A one-handled spreader board. Again, this is something which it's a very simple piece of equipment. It's just a board that lies flat on a table or a work surface to provide a useful and secure base for spreading butter, jam, and other foods on toast, bread, crisp breads, and similar items. A wheel trolley, which you can, obviously on 4 wheels, you just push it into the kitchen, pick up your meal and take it back into the living room or whether you're eating, just to move items, food items around the home. A long handled reacher, which enables people to reach items without having to bend or stretch. And that's about things like getting the post from the front door. You can use it to pull the curtains too. Yeah, really good piece of equipment. A Breville hot cup or hot water dispenser, which will boil and dispense a single cup of water in seconds. Ideal for somebody who can't use a heavy kettle. The one-touch operation and hinged lid facility is easy for easy filling, and the manual stop function gives control over different size cups. A non-stick table mat is just designed to provide a firm and secure grip on tables and other flat surfaces to prevent plates and glasses from slipping. Bathroom and personal care, grab rails and suction rails. Again, in years gone by, these items of equipment always looked quite old-fashioned, in my opinion. Nowadays, you can get plastic grab rails. They fit on, they suction. They no longer have to be drilled, or not all of them have to be drilled into the walls, and they look more. They look better than the old metal grab rails did. They look more decorative. You can get a fully adjustable toilet surround rail, which helps anybody who has problems getting up and down from the toilet. You can actually use the hand grips for additional support and comfort when getting up and easing yourself down onto the toilet. A long handle loofah, which you can use if you have in the bath or the shower to wash your back, etc. If you have difficulty moving your upper body or due to pain. A foot washer, which is just a device that can be attached in either a bath or a shower to enable hands-free foot washing. And it's a really good aid for those with limited lower extremity movements, back pain and balance problems, and saves you having to ask somebody to wash your feet. A long-handled toe towel and replacement towels, which are useful for people with reduced mobility and balance problems, which enables the user to dry between the toes. A long-handled body washer and replacement cloths, someone would benefit from this to aid you when showering and bathing. It's just like a loofah, but it's actually got a cloth on it. You can get around the back into areas that you can't necessarily reach. A long-handled hair washer makes it easier to reach your head without strain on the hands, shoulders or arms. It's oval shaped and it's non-slip material, ensuring a secure grip at all times. Hands-free hairdryer, a convenient stand that holds the hairdryer for you one-handed for styling or drying. Amazing piece of equipment. Long-handled hairbrush and comb, which is diagnosed to assist those who cannot raise their arm or reach behind their heads to brush or comb their hair. A simple thing which makes a big difference. Shower chair, obviously, or shower stool to use in the bath or in the shower, and it's height adjustable with handles for use in all wet environments, which means you can sit down while showering rather than having to stand. An alternative, obviously, is the provision of a wet room. Adjustable width bathboard, which is sturdy, comfortable, and a safe platform which attaches to the bath on either side and assists the user with safe bathing. So the bathboard is placed onto the bath, you sit on the edge, pop your legs over, and then you're not sitting in the bath, you're sitting actually on the top. A bath lift, which is exceptionally durable and robust and lightweight, battery powered, fitted with an easy to use hand controller, where at the touch of a button, the bath lift gently lowers the user with a restricted mobility down to the bottom of the bath and raises the user back up with maximum safety when getting in and out of the bath. Dressing. A dressing stick can help with putting on jackets, shirts, socks, skirts or trousers. A bra angel for the ladies out there assists with putting on and taking off a bra with one hand. A sock aid, as it says, helps users to put on socks independently, and a tight aid, again, enables users to put on tights by themselves. A long-handled shoe horn assists with putting on shoes without the need to bend down. Elastic shoelaces, which look like normal laces but benefit from stretch elastic, making it easier to put shoes on independently without the need to bend to tie laces. Coiler shoelaces are easy to use and never need tying. They are suitable for training shoes, no pressure points, and allows natural movement. There's a range of colours available. Furniture, an overbed chair table, which is height adjustable, provides a table and smooth surface on which you can eat, work or enjoy activities, and prevents you from having to keep getting up from a seated position to go to the table. Height adjustable perching stool with angled legs, giving maximum stability and suitable for use around the home. Most of my clients will have a perching stool within the kitchen and the bathroom, so they can help to prepare meals in the kitchen, and they can also sit and have a wash at the sink using the perching stool. Dual motorised and recliner armchairs, which are electric recliner chairs. Back and leg rests can be positioned independently for maximum comfort when sitting or reclining. They come with a hand controller. They're simple to use, quite expensive, but really a good buy as long as you've got the correct amount of space in the house. Any questions?
Thank you, Sue. I really appreciate it. An amazing talk, and really went into detail of a lot of the things that a lot of our clients and patients really struggle with. So, you know, you really did a great job. So thank you, Sue. Really do appreciate it. Let me just see if we've got any questions that come in. Lucy, do you want to take off the screen share and we can see Sue and Damian? Okay, so the first question. So this is about reasonable adjustments.
Okay.
The question is, who pays for reasonable adjustments at work after a legal claim? Is it me or my employer? Sorry about that, it's a tough one.
It says the best. it is a tough one and it is difficult. There is a duty of care from every employer to make reasonable adjustments for clients within the workplace. However, when a legal claim has been finalised, it would be easier to do this whilst the claim was going on, in my opinion. When I do care assessments for clients, I tend to recommend what's called a vocational case manager. They help with all aspects of returning to work. If someone who has CRPS really wants to get back into the workplace, it will depend on a number of factors, clearly. Not always an option, but for those who do want to return to work, they need help. And that's where vocational case management comes into play. They will assist the person to go into work, discuss what their needs are, consider the environment, and to recommend any aids and equipment which will be required for that person to continue with their role as they did previously, but with the use of the relevant aids and equipment. And no employer should be opposed to that. If a claim is already settled, then an employer cannot, in my opinion, just turn around and say, well, we're not making anything easier for you because you've got any problems. There are simple things such as the height of a chair, the height of a table, a monitor, a different screen, being allowed to take breaks, things like this, and things that everybody with CRPS will need access to. The waters are a little muddied though if this happens once a claim is settled.
That's right. So I'd just add that the Equality Act 2010 provides that it is the employer that must make reasonable adjustments. They can't ask the employee, but the exception is that if there's been a coordinated approach with the vocational rehabilitation provider and that a certain sum has been recovered in the claim for that purpose and the employer has been obviously notified, but if there was no such provision in the claim and the client has then received their compensation and there's been no coordination with the employer, then the employer can't turn around and say, I've heard that you've received some compensation, I want you to pay for any adjustments in the place that will allow you to return to work. So it is a complex area, but if any of your members are asked this, then I think that they should seek some employment law advice, because it's the employer who has the duty to make the reasonable adjustment, not the employee themselves. I'd just add as well that there's an access to work scheme that members can access that they have to apply for themselves via the government website, and they can ask for an assessment to be undertaken. And if they're having trouble accessing transport to get to work and things like that, there are certain monies that can be applied for to assist them. So that's not the employer who's applying for that, that's the employee themselves. That's a slightly different topic, but it's along the same lines. Is
there also a grant, Damian, that the employer?
I believe that there's a separate grant that the employer can apply for making reasonable adjustments, and that would be normally things to do with specialist display equipment and certain changes to desk heights and things. I think it's only if it's, as I say, specialist equipment, you can't get a grant for work equipment that would ordinarily be provided in the workplace. It would have to be for someone who has certain needs. So that's right, but that would be for the employer to make inquiries.
I think it's a really valid question. I think it also raises the issue, obviously, of making sure that when we're dealing with these cases that we cover the vocational aspect as robustly as we can.
Absolutely, yeah. I'll be taking that in all my cases going forward. It's a really good question. Thanks to the member who raised that.
Yeah.
Yeah,
do we have any more, Victoria?
Yeah, we do. I mean, in going on the reasonable adjustments, Sue, what kind of reasonable adjustments? I know you mentioned a couple, but could you possibly either recommend or places to go to get that kind of equipment?
Oh, reasonable adjustments. I mean, obviously it will depend on the person. I mean, some of them are quite obvious, but you would think, wouldn't you, that wheelchair access And again, that would be a big question with any employer. You'd like to think that people would have wheelchair access nowadays, but I know it's not always the case. Rest, everybody needs to have breaks, but that's something that, again, whoever's employed, they will be talking about that with it depends if it's a new job or if it's a job they're just applying for, if it was something they were doing at the time of the injury and the time of the diagnosis. As Damian's just said, it can be height adjustable chairs, neck supports, different displays, even supports for their arms, footstools to put your feet on while you're sitting and you're actually working. If you're working in a desk job, clearly, and accessing these sorts of equipment, it will again just be simply online or local shops. And my advice to anybody would be, rather than going online, give your local disability equipment store a ring, and or do Burning Nights do anything? Do they cover any? Have they got any advice in that sort of area?
Yeah, we've got a list similar to yours, but also a list of places where people can go. And we've also got a subsequent list that we hold in the office about places they can go. And yes, disability stores tend to, but stores and companies like Vela Chairs, for example, the activity chair that can be used both at home, but also at study, if at universities or college, but also in the office as well.
It's quite amazing, actually, the amount of equipment there is nowadays. I mean, as you saw from the slides, just some things that are really quite basic that we all take for granted, and yet there's something out there for most things. And I always find that Disability Solutions are quite a good website as well. But if you ring up, because they work in this area, they can be quite helpful. And if you go in and and even if they haven't got something in stock or in store, they will more than likely know somebody, and they can signpost you to that.
Brilliant, thank you. And thank you as well, Damian, for that as well, for the legal side. We've actually got another question in, so sorry to keep you both. This one is on entitlement to benefits. So the question reads, you've said that I can check for my entitlement to benefits and claim those, but what happens to my benefits if I receive compensation for my claim? Do they stop?
I'll take this one. So there's sort of a couple of layers to that question. So if a claim has been made for personal injuries and the client has made a claim for benefits, then at the end of the case, the paying party, the compensator, is obliged to repay to the DWP the amount of benefits that have been received. Now, that's on a like-for-like basis. So, for example, if someone's received benefits that would be linked to loss of earnings, say they had £10,000 there, and their claim for loss of earnings was more than £10,000, then the set-off of £10,000 would be made in their claim, and that would be repaid by basically the insurance company and deducted from the amount that they receive. So sometimes clients might say, well, if I'm successful in my claim, then I'm going to pay back the benefits. What's the point in me claiming benefits now if I'm only going to have to pay it back? Well, I'd say that you would only have to pay it back if you're successful in the claim. So if for some reason you weren't successful, and obviously we would hope you were going to be successful, but there's always a risk that you might not be. So you would have received those benefits and you wouldn't have to pay those back. If you hadn't made the claim, then you couldn't retrospectively claim those benefits. Secondly, it's only a period of 5 years from the date of the accident that these benefits are recoupable. So if you have got an accident and the claim goes on for more than 5 years, and if it's a serious claim, they can often stretch to beyond 5 years, then there's a ceiling on the amount that can be reclaimed. Also, your general damages, which is normally your pain, suffering and loss of amenity, that will be taken into account in any lump sum first of all. So let's say you receive £30,000 for pain, suffering, loss of amenity, then that will be sort of ring fenced before they look at the other heads of loss that have benefits attached to them. So such as care and loss of earnings. So that's how that would work. In terms of the question about the entitlement to benefits after the claim, if they were claiming means tested benefits, then obviously if they received a large award and their bank account had a considerable sum in it, then they would lose the ability to take those benefits. However, there is a possibility on settlement, or preferably looking at it on any interim payment that's received, the ability to set up what's called a personal injury trust. And that's just a fancy name for a separate bank account that is sort of has a wrapper on it to say that these monies have been received due to a personal injury claim, and therefore they're not to be considered in any benefits assessment. So as I say, it's effectively a bank account. The money isn't locked away forever and a day. You'd still be able to arrange access to that money, but the advantage is that you would then be able to continue to receive benefits as you move forward, and hopefully in that intervening period whilst you try and return to work. Otherwise, if you didn't do that, your benefits would stop if they were means tested, and you may well be sort of out of pocket. So sorry for the lengthy answer, but hopefully that covers all bases.
Yeah, I think so. I think benefits is a big problem, obviously, for patients and carers, and I know it's been touched on today, which is great, so thank you. We find that a lot of patients struggle to get the idea of CRPS across, so I think Sue will probably understand that as well. It's the idea of that they are in pain, and benefits advisors are not always understanding of the condition as well.
Pain is just so subjective, and it is what the person says it is. Everybody's experience is different. And I've been to tribunals and I've been to assessments for PIP and different things with people in the past. And, you often get a doctor that's, dare we say it, not a pain specialist. And the questions they ask are quite irrelevant. And when you try and put your point across about how your pain affects you every day, what you can't do, as you say, Victoria, it's completely missed. It's very, very difficult. And when you walk into somewhere and you look just like everybody else that's walking down the street with a disability that isn't obvious, you're up against it from the go-get, really.
Do you have any recommendations of how someone can get across the fact that they're in that pain? I mean, something we say is about pain diaries. Absolutely.
I mean, I'm quite fortunate, I think, in the role that I do at the moment is I can ask somebody to give me a day in the life, or I ask my clients to provide me with a week's care diary, and it can be retrospective because most days tend to be very similar, and just let me know all the help you need from the minute you get up until the minute you go to bed and overnight for a full week. And because people have lived with this for so long, they forget how much help they need. So once they start writing it down, as we said earlier in the presentation, it's only then they think, oh, blimey, I can't do that. He helps me with that. So what I would say to anybody is, if you could do something like that and take it with you, as you've just said there as well, a pain diary. If you've got any information from, if you've been seen at the pain clinic, they should do you a letter. Or if you are seen by a counsellor or anybody, they would be able to help as well. But if somebody just writes down what they can and they can't do and how it affects them. And even something like taking your list of medication with you, people aren't put on high levels of analgesia for nothing. But it is difficult, it is.
Very true, right. It is difficult. Damian?
I'd just add to Sue's recommendation about pain diaries. Again, they're essential, and in a claim for CRPS, we'd always ask the client to maintain a pain diary throughout the claim, because it's a great reference point. And in certain cases, we'd even go so far as to arrange videos of a day in the life, because again, it's just there's no substitute for conveying the amount of assistance that people need.
I ask my clients to give me always to rate pain on a scale of 1 to 10, with 1 being the least and 10 being the worst pain you can imagine, and that's informative. But I'm glad you said that, Damian, because actually a video is I meet people when they've already had their diagnosis, when they've got a claim going on, and I can't imagine what they were like before. If somebody shows me a photograph, it's very hard to believe that's the same person the majority of the time. And if you have a video, I recently had a young man who has got CRPS, and he was trying to transfer himself from his wheelchair into a car. And I just couldn't believe what I was seeing. I just could not believe the struggle. And his parents are very elderly. And I was amazed. So when I left, I just said, look, will you do me a video and send it to me? And I've put that in with my report, because until you've seen that, he couldn't have explained the difficulties, and I wouldn't have known where to start writing it down. It wouldn't have done it justice. But I'm with you, Damien, 100%. You know, the pain diaries, and certainly videos and photographs, and yeah, a day in the life video. Yeah.
Yes.
Yes, certainly with symptoms, as you know, it can vary so wildly, and on a day-to-day basis. So we always say, if they are going through legal claims, to take photographs and videos, take photographs of their limb on a good day, bad day, and also the various symptoms that they get, because yes, at the time, the criteria of diagnosis is at the time, but it is also in the history, as you know. But it can show a progression of the disease, of the condition as well.
I mean, my clients always say, you know, they have good days and bad days, and they can't really say how many good days. And I do try and get the information, but it is difficult because some days are better than others, and there's so many factors. But just going back to benefits, it's just made me realise that a lot of my clients say to me that when they apply for benefits, they have to give a worst case scenario. So when they're applying for PIP, for example, which, you know, is a ginormous book to fill in, they have to give a worst case scenario. So that is something else for people to think about when we're talking about benefits as well. You know, imagine the worst day that you have, and that's what you need to be putting down to be entitled to get something. Sorry, I've just thought about benefits as we were discussing things.
No, quite right. And the other thing is, if it was an accident at work, industrial injuries benefit.
Absolutely.
It's one that's often forgotten about.
Yeah.
But if it is an injury at work, then obviously, you know, Damian, would you agree with that?
Yes, I do. Yes, we always recommend our clients on accidents at work, which we call employers' liability cases, to consider applying, because it although it's not a lot of money, it's probably £100 every couple of weeks or so. It's something, and obviously it's better than nothing.
I think a lot of people just tend to try and get on with it, don't they? And then when I visit, or somebody professional visits, and you sort of start delving into what they can and they can't do, which is really upsetting for people. It really, you know, it's not nice at all when you're doing it, although you have to. But then when you start thinking about what they can apply for, because they just don't realise this is the new normal. The way things are now is the way life is, and it's not, you know, it's not like it was 4 years ago before diagnosis. So actually, they are having a lot more support than they realised. And once they realise that, then they think, oh, well, a lot of benefits aren't claimed, and people should be more aware of it.
Absolutely.
I think benefits is kind of a bit of a maze, shall we say?
Yeah.
And trying to find the right one and the right ones is difficult. We are an organisation member for Access and Work and Benefits and Work, and they provide guides on things like PIP, ESA, DLA as the old PIP as well. So, you know, they can always go there, and also citizens advice as well. We always advise, because there's usually a benefits advisor or a local law centre. Sometimes they have a benefits advisor or welfare advisor there as well.
Yeah.
I haven't got any more questions. Is there anything else either Sue or Damian you'd like to finish with?
No, I think we've covered lots of ground today, and thanks again for inviting us to speak. Burning Nights CRPS support is a fantastic charity. We've just been talking this morning about how good the website is, and I understand the new website is coming. The wealth of information that's there, and members should really dive in and find out more. And the legal panel page is on there as well. If you do want to get any legal advice, contact me. I'm pleased to speak to anyone and give them some advice where I can.
I will
Sue, well. Thanks to
Sorry,
Sue
Damian.
for taking all the time to attend today. It's been really informative, and thanks very much.
It's been a pleasure, thank you. And yeah, I will certainly be telling all of my clients that have CRPS and related pain symptoms or syndromes that of the Burning Nights website and the information that's on there, and the wealth of support to people that really are feeling very isolated and very vulnerable. It's going to be invaluable for the people I see. So thank you very much, Victoria, and thank you, Damian.
Thank you, and thank you to both Damian Bradley from Express Solicitors and also Sue Tomkinson from Maggie Sargent and Associates. Thank you for today, and thank you for the access to services. A great webinar overall, so thank you both.
Thank you.